Hello, this is Megan Boyd. We're going to be talking about Cymbalta or duloxetine. The uses for this medication include fibromyalgia, depression, and anxiety. The first thing we're going to talk about is the pharmacodynamics, or the effect and the reaction that Cymbalta has in the body. Cymbalta or duloxetine inhibits the reuptake of norepinephrine and serotonin and enhances the levels of dopamine in the prefrontal cortex, which has the prefrontal cortex of the brain has a lot to do with depression, and managing the prefrontal cortex is huge in depression. So Cymbalta, being that that's how it works, is a great drug of choice for depression. It's also used for fibromyalgia, for the pain. And the reason that the dopamine level in the prefrontal cortex is enhanced is because of the inhibition of the norepinephrine and serotonin reuptake. That was a mouthful. So that is how duloxetine or Cymbalta works in the body. The process by which the drug is absorbed, distributed, metabolized, and eliminated. So Cymbalta's half-life is approximately 12 hours. It's absorbed after 2 hours and reaches the peak concentration in the body about 6 to 10 hours after it's taken. So within 6 to 10 hours of taking Cymbalta, you should be noticing the maximum effect in the body. So Cymbalta is highly bound to protein, and the volume of distribution is about 1,640. There's no difference in men or women if it's metabolized faster or eliminated faster, and it's excreted through the urine, but mainly metabolized in the liver. Reasons that you should stop taking Cymbalta if you're already on it would be if you have higher suicidal thoughts, if you develop serotonin syndrome, there is a chance of hepatotoxicity, syncope, syndrome of inappropriate antidiuretic hormone, or SIADH, and hyponatremia. That's another big one in the elderly. Common reactions to the medication or side effects would be headaches, diarrhea, insomnia, fatigue, dry mouth, abdominal pain, and weight loss. Those are major things that typically happen when taking Cymbalta. Some special considerations for pediatrics and the elderly. So there are certain diagnoses in children that this medication or Cymbalta is used for. Children 7 years old or older can use this medication, Cymbalta, for anxiety. They usually take 30 milligrams for 2 weeks and increase to 60 milligrams after that. So children under 7 need to be further evaluated by their own physician. The elderly may be more sensitive to the drug and may have an increased incidence in falls, and they're more likely to have hyponatremia or low sodium concentrate in the blood. And then reasons that you should not take or even start Cymbalta, period, would be if you have uncontrolled narrow angle glaucoma that's in your eye, or if you've used MAOIs, you should avoid using any kind of SNRI or SSRIs like Cymbalta or serotonin, norepinephrine reuptake inhibitors, because there could be some fatal interactions there with the MAOIs and the Cymbalta in the body. So those are just some really good things to watch out for when taking the medication. But if you have any reactions to the medication, it's really important to talk to your physician about that. And that is all I have. Thank you.